Namaskar and good evening to all. A very warm welcome to everyone present here. Today we have 74th session of the Virasat Talk program being organized by the Archaeological Exploration and Excavation Department of Heritage Society, Patna. It is my immense pleasure and honor to welcome today Dr. Veena Mushrif-Tripathy, ma'am, in our today's lecture. And the today's topic is quite very interesting. It is on paleopathology and its implication. It's a very unique topic, and not much has been done in this field. And Dr. Veena ma'am is among one of the few scholars who are working in this field. Let me very briefly introduce Dr. Veena ma'am for the audience, for those who are seeing her first time. So Dr. Veena Mushrif-Tripathy ma'am is currently serving as assistant professor in physical anthropology at Department of Archaeology in Deccan College of Postgraduate and Research Institution, a premier institute located in Pune. Dr. Veena ma'am is specialized in working on human skeletal remains and excavated from different archaeological sites. She is working in this field for last 20 years. She has published more than 6 monographs and around 45 research papers in reputed national and international journals. She has also been awarded with many national awards and such as National Geographic Funds to carry out research works in various regions. She has also worked in the regions like Ladakh and many other places. She is currently working with national and international teams on DNA and isotopes and other scientific aspects. Without taking much time, I would request ma'am to kindly begin the session. Thank you, ma'am.
Good evening, everyone. Thank you for a brief introduction, Azad. And I will right now share my screen and I will start my presentation. Thank you, everyone. I hope you are able to see my presentation properly. I will be talking about paleopathology, its implications to understand the past population. That is my topic, and I'm very fortunate to be a part of Deccan College legacy, where the archaeological sciences are being taken very seriously. The points which are covered in the presentation is paleopathology, its methods and limitations, categories of paleopathologies, and understanding why we actually study those pathologies, basically to understand the socio-cultural context or aspect of the past population. That is what my presentation is talking about. So when we talk, most of you are from archaeology background, but some of you are from different background. Just to show you a few slides of how we find human remains from archaeological excavation. So you can see there are different ways of seeing. Like this is a 4-leg jar, very different way of burying the dead. So you are the skeleton is in seated position. Here twin urn burial, where we can have child burial, which is very commonly seen in the Deccan Chalcolithic population. Then this is from the Ramapuram extended burial. So this is a twin burial from Inamgaon, then multiple burial from Inamgaon, and this is a seated burial from Balatal. So this is how we get skeletal remains in different modes, different patterns, different way they are buried. So we study those skeletal remains and try to understand the biographies or osteobiography. What we call is osteo means bone and biography means life history, understanding the life histories of bone. So paleopathology is one portion of it. So it is like essentially can be defined as a study of ancient pathologies or suffering. So it is both, paleopathology incorporates both human as well as animal bone. But I will be focusing on humans as I work on human remains. So the objective of paleopathological research includes that diagnosis of specific disease of through bones or human remains, analysis and impact of various diseases in human population through time and space, because our society is evolving, our culture is evolving or changing. We cannot say as evolving, but it's changing. So our pathologies or diseases, pattern of diseases are also changing according to our lifestyle. So how it is been changed, clarification of evolutionary interaction between humans and disease, that again the same point carried away, like how we are coping with each other, like if the pathologies are or diseases are changing, so the humans are changing, and so the humans are changing, the disease patterns are changing. So how we can understand this difference, how we can understand these interactions between these two. So basic to all these objectives is the need for accuracy of understanding the disease in archaeological human remains. So this is what the paleopathology talks about. The scope and objective of pathology is what the lesion normally is, the diagnosis part. Like once we see what is normal bone and what is abnormal bone, so what is the diagnosis of it? Then how the lesion is formed, what are the factors which lead to particular disease or methods of diagnosis. Then why the lesion is formed, conceptual framework. Certain pathologies are more prevalent in certain society or certain framework of society or framework of culture. So conceptual framework, that is more important. And these are the very potential areas of research where anthropologists can contribute a lot in this diagnosis. It's more of a forensic way of looking at the human remains. So different methodologies are being used to understand the pathologies, like microscopy, both histological scanning electron microscope, SEM, what we say. Then the radiology, which includes X-ray, CT scan. Now we can have the MRIs also included in that. Then the bone chemistry includes trace element analysis, stable isotope analysis, or any other chemical analysis of bone which can tell you about the diet or the particular pathology or diagnosis can be done using the chemistry. Then DNA sequencing, it all depends on the survival of DNA, but you are able to get, there are certain studies which could lead to and know the history of pathology, like particular pathology, so like tuberculosis or leprosy or malaria or any other plague, for example. I will be talking about it later on. So how we can identify these through DNA. Then the other resources are archaeological evidence and literature. Through literature also, like in case of medieval time frame or early historic time frame, when we are having the literature also and the archaeological evidences, so can we collaborate both the things and can get the information about particular disease or the prevalence of particular disease in that society. The other thing is epigraphy, iconography, or drawings. So iconography, you have seen somebody with a humped back, or somebody is giving birth, like you. These are the common iconographic depiction. You can see some faces are very crude, like we say it as Devi. Okay, with the disease. So all those things can be able to identify certain examples of these kind of diseases from the iconographic representation. So all this is very interdisciplinary. Interdisciplinary approach is very much required or desired to study the pathology. There are a lot of limitation though while studying pathology, like studies very restricted largely to those diseases that affect the skeleton. Uh, when some disease attack on the humans, so first is skin, then the muscles and tissue, and the last element in our body, the bone, is the last one to get affected, and it is the the disease has to be prolonged. It should not be like immediate cause of death or immediate and it is remain for certain time and then then it is got cured. So there is very less time for bone to develop those kind of indications, markers. So bone so there the prolonged sickness is always get recorded in the archaeology, but not in the short terms. So a second problem with the pathology is bone produces limited ways of reaction to the disease, like porosity or bone formation, or we call it as osteophytic growth or osteoclast. So all those things, like the development of bone in particular area or of affected bone, is so very limited ways bones can tell us about their problem. So we have to actually decipher what exactly the pathology is, where which bone is affected and how far it is been affected. Through that we can identify whether it's a serious disease or it is just a passing evidences of certain small scale problems. So these things can be understood through, but not but it is a problematic area when you are trying to identify the pathology. Determine the cause of death is always a problem. Until otherwise, like if you have say something like butchering marks or cut marks near the neck area where your second vertebra is can show you certain kinds of cut mark. So then we know that it's probably led to the death of that person or certain things. But many times it's, if it is not recorded in bone, you are not able to identify the reason for the death. Then the population studies are studied are dead and may not represent the entire group. So if you consider like large cities like say for Harappa and Mohenjo-daro or Harappa, so you are getting some skeletons like 200, 300 maximum, but they are not actual representation of that particular population, because 300 does not belong to one particular time zone. It is like series of events or series of different chronologies been seen in that. Like some are the early Harappan, some are them are mature Harappan, some of them are late Harappan. So actually whatever skeletal population you are studying, they are just a few representation of the living population. So you are not studying actually the entire group. So there might be certain there are certain lacunas in studying the pathologies or kind of diseases they were exposed to. So, for understanding our pathological observations, these are the main divisions we can see. We have developed like congenital disease, which are developed abnormalities in the skeleton. Developmental, they are when the child is inside the womb. So from there you are having the congenital. Then infection disease, traumatic lesions, joint disease, metabolic disease. I will come to one by one. So these are just to tell you, these are the different ways of identifying, under which we can identify or segregate the pathologies from the what we get from the bones. So come to the first is congenital disease. They are mainly physical condition deviating from what is acceptable as normal. And so when the child is inside the womb or is in fetus and it is developing, during that time if there is some developmental problem happens, then these comes under the congenital. So in archaeological context, most of the anomalies are minor, because if there is a major problem or the congenital issues with the child or with the fetus, then you will not get evidences of that in modern in the adult population. So they might have just died and just like very, or they died during the birth time or not. It's a very rare condition when you find the congenital, very severe type of congenital diseases in uh, archaeology. But so whatever we get, they are of a minor variety. So these are certain cases where you can see. So this is a spina bifida. This is a sacrum, the last vertebra of the column, and you can see this neural arch, this area is open. This is called a self palate, and then this is a called trigonocephaly, the triangular head, or this particular head is triangular. Then these are the staphylitific. So these comes under the congenital, where they are called as a developmental issues. So these are some more of that he can see. These are adult. This is from adult vertebra. So you can see this particular portion is not formed in this. So again, there is a foramina here. It is incomplete. It's not completely formed. If you can see the first rib, the right and left has a very different type of shape. So these count are very minor. They do not cause much. This do not cause much of problem, but this there is a possibility that it can cause some back pain and certain health issues with that particular person. Coming to the next is infection disease. These we get a lot in archaeology because most of the we get infections from very young individual to very old individual, and they are very commonly found in the archaeology. And there are main two types in of infection. One is non-specific, where we are not able to tell why this particular infection is present on that bone, but there is, you can see some abnormality. And there is something called a specific infection, where it is caused infection, it is possible to diagnosis, like for example leprosy, tuberculosis, trichomonas infection. These comes under the specific infection. So you can identify which pathology it is this seen on the bone. So when you talk about infection diseases, these are the way you get infected, for either with the viruses or bacteria. As we are going through the COVID-19, this comes under the virus virus category. Bacteria is tuberculosis, or which can be done by the harm can be done by the bacteria. So how it spreads, actually, when we talk about the infection, spreading of infection, first level is the exposure to those, either it's a virus or bacteria. Then second is the individual gets infected. Third is transmission from person to person or from animal to person. And later, the fourth stage is it spreads the epidemic. As we can see today, the COVID-19, it is spread all throughout the world. So it is now pandemic. It's not epidemic, it's a pandemic. So it got first exposure, then it spread entire the world. So it is like this comes under the infection category. So as I was telling you, it is from, there are different ways, like human to human, animals to human. So COVID-19, as you can see, it is from the animal which has got introduced to humans, and now from humans we are everywhere. Everybody is prone to have that kind of infection. So this is infection. So non-specific infection is like, as you can see here, that there are infection here, like these are the infected areas what we can see. Then these are the areas where you can see the porosity, or here densely porous bone. This is a very young child, infant, and so this is what you get in the archaeological population, but you exactly cannot identify what is the pathology behind it. It might be related to the nutritional deficiency in case of this particular individual, or it is a infection. So it is very difficult. The specific infection is trichomonas. This is one of the very good example of trichomonas infection. This is the skull from Agripalli. Trichomonas infection is the infection which is done by the bacteria Trichonoma palladium, and then it is there are a lot of ways, like Yaws and Pinta and other places, and the syphilis, mainly the syphilis. So these are comes under the trichomonas infection. As you can see, there is a very large nodal lesions on the fibula, and this is a tibia swollen. So this indicates to you the graveness of the disease. So this is one more example of trichomonas infection. As you can see, the bone is completely damaged here. You can see the face. So how the bone looks like here. So this is what it looks like. So it is where you can be absolutely sure that this particular individual was suffering from some kind of a triponormal infection. May not be the syphilis or pentaurias, but it may be a triponormal infection. Then this is a tuberculosis. You can see there is this is a rib fragment, and you can see rib area, and you can see these are the woven bone or laminar bone. So this is, and this is also the development of the bone here, the damage of the vertebral column, and here this is a mummy, and you can see the, because of the tuberculosis, it has created kind of a humped back. So it shows that this particular individual was suffering from the tuberculosis. This is again a tuberculosis from Harappa. We did analysis some time ago in 2013, and we could identify the tuberculosis lesions on the Harappan skeletal remains. So you can see the typical lesions on the vertebral column. Then the leprosy. This is the first time the leprosy was identified in Indian subcontinent, and you can see there are a lot of lesions which tells you about this particular individual had suffered from the leprosy. Leprosy is basically when you see all the extremities of the body, like your nose, your this particular portion, okay, subnasal region, or your chin, or your hands. If you know that hands and or the legs, the extremity of the fingers, all they start getting deteriorating, and slowly it you lose the bone. So this is what we could identify in the specimen from Balatan, and this is referred as one of the oldest individual suffer from leprosy. So this is very interesting case of infection. Coming to the next is trauma. Trauma is again it has been recorded since long time because it is extremely visible condition from the skeleton, and there are a lot of variation of trauma. Trauma is like any kind of damage to the bone, like fractures. Today, if you fall down from the motorbike or something like that, you have to go for the fracture kind of, the bone gets fractured and you have to go to doctor to for that fracture. So fractures, crushing injuries, or wounds for or dislocation also. So all this comes under the trauma. So it is a damage to the body. And anatomical importance and sociocultural implications of trauma in antiquity long have been recognized. And if you get healed injury, which again tells you about the medical knowledge of that particular society had, because it is very difficult to heal the fracture. So if you have healed wound, which means that the society has certain knowledge about medicine. So here what you can see, this is actually not directly it's related to the joint disease, or it's more of a, not exactly joint disease. It is when you are having a lot of acids, so this kind of osteochondritis is developed in the toes area. This is a very interesting case which was reported by Professor Valimbe in when they studied the S. Papinaikan Patti from Tamil Nadu. So what is this is a skull of a young old individual, not young, old individual, and what you see is it is a sharp cut mark on the occipital, on the back side of the skull. So that portion is scooped out, and that person did not die because immediately because of this, but you can see the secondary bone growth here. So which shows that this particular individual was alive for certain days, not for months together, but certain days after this particular grave injury. And the society had some, this person, this is a male individual around 50-year-old. It is from Iron Age side. So here what we can see is probably some kind of a sword like, okay, some must have just kind of scooped certain portion of his skull. but it survived. The society had some kind of a medical knowledge or some kind of system where this person, such a badly injured person, could live for so long, maybe 15 days, maybe 1 month or 2 months, not more than probably. But this person was alive. So it shows that. The other here, what you see is a green stick fracture. Green stick fracture is mainly happens when the bone is still developing. So when the bone is developing, it has a lot of elasticity. So the children bones do not break very easily. They bend first because it has a elasticity. So if you try to break a green branch, it does not break immediately. It just kind of bend, and then eventually it breaks down. So from that, this particular name has come as a green stick fracture. So this is a very interesting. So here, like children, we sometimes they fall down, or sometimes they, while taking the children, or some accident, but they do not get fractures easily. Okay, so this is called as a green stick fracture. This is a very good example. This is one site from Orissa, Chalcolithic site, Harirajpur. Here, what you can see, the radius ulna means this hand. Okay, so it is completely healed fracture here. What you can see here, this is a completely healed fracture. For both here we have two bones, radius and ulna, and they both got fractured and they got healed also. But they did not heal it properly, so that's why there is a kind of a bend there. Here, this is from Rupkund one side, and here we can see the tibia, the shin bone. Basically, it has a fracture and it has joined very weirdly. When something fractured, the doctor, what they did, they put properly those fractured pieces and they kind of tie everything. So if that condition is not there, then anyways the bones, because bone has a tendency to grow. So when the two live bone comes together, then you have this joining of the bones. So that can be seen in this particular case. Even in this particular case, even here also, tibia and fibula, shin bone, and next bone is called as a fibula. So here you can see these are the bridge which got connected. So this is again a fracture. This is called as antemortem and postmortem. What I told you about the Rupkund, this is a skull from the Rupkund, and what you see here, this is the perimortem. Perimortem fracture means we do not know exactly when it happened, either just before death or after. But it is antemortem, we say it because certain bone portion are still attached to the down. And Rupkund is a glacial lake, and we studied those skulls from the that regions from Rupkund. And probably one of the theory, which we believe it is the right theory, that hailstorm came and like cricket size ball, so they just fell down the skulls, and many of them have got stuck up there and died because of the hailstorm. So this is a very good example of antemortem fracture to the skull. Coming to the next is joint disease. It is most commonly found disease in archaeological specimen. So there are called as we know it as them as arthritis. So most of the old generation, they are having this arthritis issue. Even the today's time, like the young generation, as young as 25, they have problem with the neck vertebra because they are sitting in front of the uh, laptop and doing their job. So you are problem having the problem of neck vertebra. Some are so lot of problems there comes under the arthritis. It may be the vertebra, it may be any joint of the body can get affected with the arthritis. So these are the different involved areas, like breakdown to the articular cartilage. Cartilage is basically between the joint there is a cartilage which makes our movement very easy. If the cartilage starts disintegrating or they are degenerating, then the bone starts coming closer, and because of that you get pain. So then you are having the cartilage loss, then coming of the bone, and then the bone formation and new osteophytic growth happens, and then because of that you are having the joint issues. So when you do surgeries, the knee surgery, people might be knowing about it. In the knee surgery, what they is generally done is they, I can show you here. So here is a knee affected knee. It is called arthritis, knee arthritis you can call it. So you can see there is a lipping or osteophytic growth or new bone growth here along the femur. Then the patella or the kneecap is again affected, and and this is the tibia. So the entire knee is affected here. So generally, when these kind of things happens, the doctors today's doctor, they cut the bone and they replace the cartilage with the plate, so it makes it easier for movement. So these are the things can be. So here some of them arthritis is, this is a mandible. So basically we are talking about this portion, mandible, where the mandible, or the lower jaw fits into your the skull. Okay, so when there is some kind of a stress to your jaw or eating or something like muscles here, so it can create this kind of a mandibular temporomandibular joint, it is called as a. So it can, this is a condyle. So this is a vertebra where you are having issues with the arthritic problem. These are the first two cervical vertebra. This is a lumbar vertebra. As you can see, there is lot of bone growth and problem with the um vertebral column. Here you can see this is a different thing, like here you are having acetabulum. Acetabulum is where actually the hip part of a hip bone, where the femur head goes. So if you are having joint problem, this is a femur head. If you are having joint problem like this can be reflected in the degeneration of the joints. So this is what I told you about, is the knee joint, and this is about the hip joint. Coming to the next is metabolic disease or metabolic disorders. So it is where every bone or every teeth, every element in your body, they have the cells is continuously developing. They are kind of growing. So if there's some, because of certain disease, certain anomaly, if those normal growth of cells stops, so you can see those lines in the bone or on tooth. So metabolic bone disease can be defined as a disease causing disruption in the normal bone formation, remolding or mineralization, or a combination of these, all three. So these are the indications of some kind of a health issues or diet in related to diet or nutrition. So these are very important tool to biocultural studies of past population. For example, this is called as a iron deficiency anemia. In this, you can see this is a child skull, very young child, and you can see the porosity which is not normal. So earlier it was considered as a case for iron deficiency anemia. Now they are telling that this can be because of the thalassemia also. And this is called as a cribra orbitalia, like on the roof of your orbit or the eyes, there is this kind of development happens. So these are known as a cribra orbitalia. So again, it is linked to iron deficiency anemia. So this is because of some kind of a nutritional deficiency to the population. This is very interesting. This is called as a localized enamel hypoplasia. This is a deciduous tooth from site called nevasa. As you can see, this is a depression here, which means this is a normal growth of enamel, and it was stopped because of this child was suffering from certain disease. And again, after a certain time, it's again started here. So basically what happens, the tooth formation start from the crown, tip of the crown. So slowly it actually where is the arrow? Okay, so it is starts from here, and slowly it starts like this. And during the formation, if there is a problem, it creates this kind of a depression or some kind of line, which is now known as enamel hypoplasia or linear enamel hypoplasia. This is known as a localized enamel hypoplasia. Here what you can see is it known as Harris lines or the growth disturbance line. Same thing, the bone is growing because of certain disease or certain malnourishment, the normal growth cell is stopped. Then this line is created after the person, after the child or person gets cured. Then the next growth starts. So this is also can be seen as a Harris line. Then this is a case of porosity. This is possible case of scurvy. Scurvy is vitamin C deficiency, uh, like what we call as a bleeding gums. So you are having the bleeding gums because of vitamin C deficiency. So these things can comes under the any nutritional deficiency or any health issues related to the nutritional deficiency comes under the metabolic disorders. Stress factors, which is mainly seen in the what you can say in the adult population, but you can put as a metabolic disorder to the stress also, because they are nutrition stress markers on the population. So here what we see is the stress factors is if one particular part of your body is being used continuously for doing certain work, certain activity, then that particular part or area site gets kind of modified to accommodate those kind of activities. So for example, these are the maxillary sinusitis or the infection towards your maxilla bone here. So what you see here is a depression here, and it can be related to the social cultural um, what you can say settings. So this particular maxilla or the upper jaw is of a female from Nevasa, and she was around 18 years old when she died. So 18 to 20 years old when she died. So what we assume, what we try to not exactly assume, what we try to interpret is like this is a female specimen, and how the way in which she might be she might be cooking food for many people within the house, and probably the because of the smoke from the chula, what you say indoor pollution, might have resulted into the kind of a infection to that particular lady. So different occupations like this, occupations where the smoke is kind of with impurities, and you are inhaling those impurities, the infection starts happening to your maxilla, like running nose, continuous headache, running so the coughing, these comes under the indications of maxillary sinusitis. So you should, how your occupation can result into the some kind of a disease can be seen through these kind of evidences. So this is called as a squatting facet, because squatting facet can be just sitting in squatting. This is a squatting way the this person is sitting. For pottery making, person is sitting for most of the time in a day. So these kind of facets created in the uh, tibia or the shin bone. So we can identify that this person was sitting for longer time, prolonged time, and because of that, it got that kind of a squatting facet. So it can also tell you about the sitting pattern, as well as we can indicate that the lack of furniture. Um, right now, we cannot sit in this position for not more than few seconds. But now if you go to villages, people are very conveniently sitting like this and talking for hours, because they are used to it. Our body is used to this kind of sitting posture. So because of this these sitting posture, you can develop this. So this is a clavicle or this collarbone, what we see. We can see because of lot of develop work like grinding the grains or carrying the heavy loads on the shoulder. Then these are the different ways you can see the the development or the facets has been extended or changed or modified to according to the type of work you are doing. So this is called as a handedness. Handedness is basically the girth of your bones is different, little different, little bit different from one side to another side. It tells you about the handedness, like which hand is. So theoretically it is possible to tell on the skeleton that person was right handed or left handed if there is a change. So it is possible, but many times in archaeological conditions it becomes difficult because we get fragmented bone. We have sometimes the soil is so thick that it's pressurized the bone, so we don't know exactly what was the girth. But we can say about their lifestyle using these markers. Neoplastic or newborn formation, these are the newborn formation. What we see is basically they are malign or they are not. So sometimes like cancerous growth, or these are the neoplastic growth which do not have any direct health issues from for the individual, like these kind of development of the development of the small bone rounds on the skull. So generally, many people do have, but it does not create any issues, health issues. Or the femur, this kind of long bone spur, we call it as a spur. So it is do not have issues. So, but these kind of, this is not from India. This is I got it from different websites. So what you can see, the development of bone here or swelling of the mandible, or here the destruction. So these are the growth which is actually maligned or which is dangerous, like cancer. So this can be also identified. Again, we haven't have this kind of evidences from Indian subcontinent till now. But we have few of the other types of bone development. So, other than the skull, so we are talking about the bones. Here we are. I'm telling you about few examples about dental disease. So, teeth are very important because they tell you a lot of stories about the past, about the particular individuals' hygiene. It tells you about the food. It tells you about uh, many other indications of like whether that person was busy in basket making or pipe wear, what we called as. So these are the things can be understand from the dental disease. So dental, like this is a tartar accumulation. Tartar accumulation is basically when the person here there is very large amount of tartar is you can see. So tartar is like a cement, what we call is like if you do not clean your tooth properly, the food which is stuck into your teeth becomes like hard as cement. So you go to doctor to clean those teeth. And again, so it tells you about hygienic practices. For archaeological purposes it is very important, very good, because it tells you about, if you do the chemical analysis of this starters, you can actually know about individual diet of that person. So this is very important source for our point of view. So this is called as tartar. Then this is a dental wear, very excessive dental wear. And this is a again a, so dental wear can be helpful for knowing the age of the individual. It is very important to know if the person was eating very hard food, because if you are eating very hard food, there is something called as a chipping. The enamel means what you see on the teeth white, it is called as enamel. So if the enamel is chipped out, so probably that individual was eating some very hard food. Or if the person is having a lot of caries, then I will show you in the next slides. So it is shows that it is more of a sugary or carbohydrate based diet. This is a dental fluorosis. Dental fluorosis means if your water is having excessive fluorine, so if through drinking, through exposure, if there is a lot of fluorine intake in your body, the enamel changes its color and it becomes. So if some archaeological population have this kind of a fluorine, this kind of a colored teeth, which tells you about the fluorine intake of within the water. So it is, you have to be very careful when you are talking about discoloration, because in Indian context we eat many people eat betel nut also. So it also creates a different coloration. So you have to able to distinguish what is the fluorosis and what is betel nut discoloration. So this is what I was talking about you, is a caries infection. So this is a caries, such a large caries. So basically caries means that if the food is getting, if the food is stuck into your teeth, so the bacteria starts eating. So, and because of that bacteria, you are having this kind of they eat actually, they damage because of the secretion of the acid from their stomach. So this enamel starts dissolving and it creates a kind of a hole. And uh, there are three layers. Like first is enamel, then the dentine, and then the pulp chamber. The first two are not. It does not have any direct uh, mm, kind of what you can say. You don't have to go to rush to the doctor, but if reaches to the pulp cavity where the all the so all the senses are there, you can get. So there, you when it starts penetrating deep, then you have to run to the doctor to clean it and put it as a, now you can remove also, or do root canal, everything. But here in this case, as you can see, there is a pus cavity, like the pus has started the bone, and to take out the pus from the caries infection, there is a pus cavity was created here. Here also you can see the probably this particular tooth was infected because of the caries, and to remove the pus, it the the pus cavity was created there by bone. And because of that, sometimes it comes to the antemortem tooth loss. So when the pus cavity develops, the tooth becomes loose and it is very easy to come out, and that is why you are having this kind of a antemortem. Or one of the reason is caries as well as the old age. These two are reasons when you are having the antemortem tooth loss. So this is how it looks. So when you see the old people, they eat very soft food because they do not have teeth. So they have to actually eat with the with the jaw bone, basically using the bone if they do not have any teeth. So we have to give them the soft food. So this is all can be understood from the dental disease. This is a very controversial case of dental surgery from Mehergar's side. So it is a this kind of a kind of curvature has happened, and according to the study they said that this is probably to keep the needle like that, but it is very controversial. It is not to be discussed much. This is not exactly related to the pathology, but it is related uh, to the culture, like shaping of the skull. So it is sometimes certain societies prefer to show their superiority, social superiority, using the skull shape, or using, so you, or the standard of beauty is very different with every, like lotus feet, or this kind of conical head. These are, or the long neck Karen. So these comes under the how you treat your body and how it changes according to their social and cultural behavior. So this is what I was talking about, the DNA analysis, where they have found um, the hepatitis B was earlier around 700,000 old skull gave the through DNA. They got the evidences of hepatitis B, and this is plague, which was again found in Bronze Age, and they could identify earliest evidence of plague uh, through the DNA analysis. So in this way, we can identify a lot of things from pathological observations through direct observations, or these kind of DNA analysis. So it is very useful. So coming to the social implications of the pathology, why we have to do so much pathological observations, to understand basically the culture, how, why, to interpret the pathologies in the cultural context. So this is a Daimabad. This is just to show you the floor plan. So in archaeological context, if you see the villages, in villages, any villages, this is just apart from archaeology, but in villages you see the people are staying in a very small huts, very close proximity with each other, and that is how you get very easily one disease get transmitted to another individual very easily, very fast. So you can see they're exposed to lot of activities is being done outside the house, because of the there is a very close proximity with the animals. You have to then these kind of, when it is rainy, then the transmission happens really rapidly, because it's a water, because there is no proper drainage system, there is no proper area for kind of taking your garbage. So everything is, so it is very close, and it is very small community which is staying together. So this is because of these, is a very good for the any disease to spread easily. So this is one of the reason why we can see. And the animals activity, like we are so much depend on, most of the activities is dependent on the animals, like sheep and goat pastoralist activities. So a lot of diseases which we get from the animals, like bulls, cows, like tuberculosis, bovine tuberculosis is says that one of the, then you are having lot, you have to work in the water, muddy water, so you get exposed to the waterborne diseases as well. So these our culture. So when we talk about from the Chalcolithic and Mesolithic population, when we try to understand from pathological perspective, we need to understand what kind of life they were living. In India, as everybody knows, we are not a very like certain places uh, are kind of a dry places, like they do not have water facility, or they do not have water. So you are actually drought area, where you are have to manage within the minimum water, and whatever water is available in your proximity. So so it is, sometimes it's very dirty water, it's very dirty water. Many people are coming to one place and taking the water, and it's a very muddy water. So through that also you are getting lot of exposure of this kind of waterborne diseases. So diarrhea, for example, so many children in our villages are exposed to diarrhea. So diarrhea is one disease, but because of the diarrhea, the immune system is collapses, and because of that, you get exposure to the different other pathologies. So it is not one disease. You have to see the. It is called a comorbidity, like what you see in the COVID-19. Like if you have a diabetes, or if you are old age of your BP, then there is a every chance that you might get. If your immune system is not very strong, you will get exposed to pathology very easily. So it's a comorbidity, so you need to understand the comorbidity in the any society. So even though in the villages, or not in the cities, or you can see, this is a old photograph of the bank, river bank. So many things are happening in the near. So you are cleaning your clothes, the animals in being washed, you are taking the water from there. You are, so many things are related to the water. So the water purity or the is very dicey. So what kind of water you are drinking, what kind of exposure you are getting through this multiple uses of water. Many people are kind of taking bath. So everything is, it's mixed up here. So it is very difficult to kind of ignore those issues when you are talking about the pathology. So when you talk from the Chalcolithic and Neolithic perspective, or Chalcolithic Mesolithic perspective, so you can see there is a issues with when you talk about Mesolithic population, they are very small bands, we are moving. So and when you talk about the Chalcolithic, like settled villages, so you, when there is a settlement of the villages, the population increases very fast. And if their population increases, so the increase of population density, and that is how a lot of diseases come into the picture, and then we are transmitted, then you are moving for the different resources. So again you are getting exposed from different areas, different diseases are being exposed to your native place. So all those things relates to the mortality. Not only just that, then the food habits, like in the agriculture population, is when the food is mainly carbohydrate based food, and in Mesolithic population, or it is on the protein base. So when you are having the carbohydrate base, so it is actually reduces the it gives you your quantity, but it reduces the quality. So basically, that again everything comes to the host resistance, and it results into the mortality. So this is how we can identify from the archaeological population. We are trying to interpret all those pathologies in this particular chart. And then not only just bones, we can get few examples from this Vedic literature like Samhita, Ayurveda, and Puranas. Like Atharva Veda talks about the medical system of that particular time. So we get a lot of references, like if you are having the fever, what kind of things you should eat, what kind of things you should not do, what kind of amulets you use. All those things can be seen in the literature. So we cannot ignore the literature completely. We have to take references through that. So the Vedic literature, Samhita, Ayurveda, and Puranas can be very useful texts to understand the pathologies, different types of pathologies exposed, as well as their remedies, what they were doing. They might be doing some magical or magico-religious thing, but again, there is some kind of a remedies being offered to the population. So it shows some kind of a system available for if you get sick. So this is also very important. So coming to the last slides, like different things can be done in paleopathology, like establishing the consultancy panel, then establishment of the central registry of photographic and radiographic catalog, and then you are standardizing methodology, identifying forum of experts from archaeology, biochemistry. All those things can be done. So paleopathology is ongoing on developing uh, uh, field. So it has been in India. It has come little late, but it's growing slowly, and it's taking its time to develop. So with this, I stop my presentation, and thank you for being there and listening to the talk. And if you have any question, please let me know. Thank you.
Thank you, ma'am. Thank you, ma'am, for the very wonderful presentation and a very interesting lecture on paleopathology. It's a very new and emerging field, and many of us might not be aware of what is going on in this field. So, but with today's presentation, I think we all have got a small some idea of what paleopathology is, and what this discipline can tell more about our past and the history, all about which we all are studying always. So thank you so much, ma'am, for this very, very wonderful and amazing presentation today.
Thank
Thank
you.
you. Thank you, ma'am. At the end of this session, let me extend my vote of thanks to everyone present in this session. I, on behalf of Heritage Society and its large family, which includes many thousands of active followers, I would like to express my profound gratitude first to Dr. Veena ma'am for taking out time and joining us in today's session. I'm also thankful to Dr. Ananta Dwivedi and Srimati Manika Pandey ma'am for organizing this weekly talk shows and for organizing this very wonderful lecture series. A boon for all history lovers. I also express my vote of thanks to all the members of Heritage Society, the staff, officers, Virasat Mitra, and the most important, our active followers and audience who supports us in all our endeavors in organizing this show and take this forward. So thank you, everyone. Thank you for this great evening. Thank you for joining us. Stay tuned with Heritage Society. We will have many more lectures in future. Thank you so much.
No
Thank you.
questions? As if there is no question?
There is no question at the present, ma'am. However, there are few comments which are continuously appearing on the screen. You may find it on the screen also. So we will thank you, Sanjeev sir, Dr. Ananda Dwivedi, Sanjeev Kumar Singh sir joining from National Museum, and many others who were live with us during this session.
Okay, thank you, Azan. Thank you.
Thank you, ma'am.